Without a doubt, the biggest question that dental hygienists get asked is, why are my gums bleeding? Well, the answer really is quite simple. Your gums are bleeding due to inflammation. Inflammation has a variety of causes, so let me break down some of them for you. I always like to start by making it known that gum inflammation can arise from systemic factors such as being on certain medications or going through hormonal imbalances, but if neither of those apply to you, then the most common cause of gum inflammation is simply bacterial buildup. So whenever we have plaque that sits along our gum line, it's going to induce an inflammation response. Whenever inflammation is present in our gums, we start to see signs such as swelling, pain, and of course bleeding. The beginning stages of gum inflammation actually starts as just that thin layer of plaque that sits along our gum line, and the longer it's there, it brings in all of these white blood cells to try to cleanse the area of infection. Whenever those white blood cells travel to that area, in an attempt to fix the issue, they actually start to destroy connective tissue in the gum, and that's whenever you'll start to see swelling. Over time, if that gum inflammation is left undisturbed, those little critters tend to actually burrow themselves further and further under the gum line and begin to destroy the bone that's underneath of the gum tissue. So usually whenever we get bleeding gums, the first thing I'll recommend is that patients up their oral hygiene. The best defense is prevention. So if you're able to prevent that gum inflammation from the start, you're going to avoid a lot of problems down the line. There is a silver lining, however. If you have gum inflammation and you're noticing your gums are bleeding a little bit more than usual, don't panic yet. If you're still in that inflammation state where it's confined to your gum tissue, you have a chance to reverse it yet. No worries there. Gum inflammation usually is just temporary, like I said, unless you let it go untreated for a while and it starts to burrow underneath the gum, go further into the bone, and then we start to see some bone loss. The best thing we can do is to floss and brush really well and stop that gum inflammation dead in its tracks. Our main goal with oral hygiene is to make sure that our teeth and our gums are always free of plaque. There are millions of bacteria that live inside the plaque that lives inside our mouth. And whenever we aren't brushing and flossing properly, that bacteria builds up and over time causes a lot of destruction. The good news is if we catch that destruction early on, it can actually be reversed. The connective tissue is able to regenerate, whereas the bone is not able to regenerate. So we always need to make sure that we are brushing, we are flossing, and we are coming to see your favorite dental hygienist at Polished Dental at least twice a year to get regular cleanings. And that way we can maintain optimal gum health as long as you are taking care of your teeth. And always remember, healthy gums should never bleed.